Welcome everybody. My name is Greg Mitten. I'm the lay member for Public and Patient Involvement for NHS West Lancashire CCG. I'd like to welcome you to our AGM. We're holding our AGM virtually in the wake of COVID-19 and while physical meetings are unable to take place. The draft minutes of our last AGM are available on our website www.westlancashireccg.nhs.uk. We've had no questions pre-submitted ahead of this AGM, but if you do have further questions that occur to you through the AGM, please email these to wlccg.myview@nhs.net and they will be answered after today's meeting. So that's wlccg.myview@nhs.net. Thank you very much. And I'm going to hand over to Paul Kingan, our Chief Finance Officer and Deputy Chief Officer.
Thanks, Greg. Okay, welcome everybody to our AGM. It's obviously in unusual circumstances, normally in a village hall somewhere in West Lancashire. Didn't expect to be doing this on the screen in the way that we are, but we'll try and talk through the key points around our annual report from last year and our accounts, as well as some of the highlights going forward with the CCG. In terms of our annual report and our accounts, I think it's a really good read if you get time to do that. It's online and it's available on request. I actually Googled this myself earlier on. It's very easy to do. Just type West Lanc CCG annual report into the search box and it will come up. A big thank you to the team who put the annual report together. I think it's the best one we've done. Covers a number of different initiatives. If I was going to give you some recommendations, I would recommend page 7 as a very, very short summary of all the things that we've done over the last year and all the things we're quite proud of. I think at this point as well, it's worth noticing that, worth noting that we had a change of leadership towards the beginning of 2020. We now have a new accountable officer, Dr. Amanda Doyle, and we have a new clinical chair, Dr. Peter Gregory. And I'd just like to say a big thanks to our outgoing Chief Officer, Mike Maguire, and our outgoing chair, clinical chair, Dr. John Kane. I've worked with John and Mike for many years in the CCG, and their achievements are many. They built the CCG from the beginning, put the team together, and put together a really exciting programme of work over the last 8 years. And they are sorely missed, and we bid a sad farewell to Mike and John. I'm sure we'll be in touch in the future. Just a little bit of history and geography around West Lancs. I think the key point to note about this, and the reason why we put a map on the side, is just to explain the complicated nature of the geography in West Lancs. We're only a small CCG of 113,000. Some of the average CCGs in the land are more like 250,000. But we've always felt that that would give us a focus on the West Lancashire local population. But it has presented challenges because we have had to operate between both the Merseyside health system and the Lancashire and South Cumbria health system, which hasn't always been easy and has presented challenges, as you can imagine. The other thing to note is when I first started doing these AGMs back in 2013, I think we had about 24 GP practices, and we've got 15 now. That's not because we've reduced services, that's because a number of mergers between practices have taken place. And I think the theme going forward is for practices and primary care to work more closely together. And in West Lancs, we've got 3 particular neighbourhoods where we plan to do more work and work together on a network basis. We've got one in Ormskirk and Orton, one in Skelmersdale, and one in Burscough in the northern parishes. And what these are networks looking at different populations in those areas and trying to change health services for the local populations in those areas. And I think what you'll find going forward in terms of the strategy of the CCG, and as we work as part of the Lancashire system, is that we're going to work more closely with the GPs in shaping services. And not only that, we're going to work very closely with our partners, both in the local council community, as well as the voluntary sector, and our mental health and community partners. I'll come on to that a bit later on. In terms of the funding, we received roughly 180 million from the government to fund the population in West Lancashire. And when you work this out on a population basis, it works out at about £1,500 per person. And what I'll do now is I'll just explain how we've managed the finances over the last year. Okay, the first thing to say, I stood up last year in the village hall, and I did say at the time that we were heading towards a deficit towards the end of March 2020. Unfortunately, we weren't able to do anything about that deficit during the year, and we had to report a deficit to the auditors back in March. Now, we received an unqualified opinion on our accounts, and it was all done in a fair and proper manner, but we had to report a deficit, and therefore we didn't achieve our break-even, in-year break-even duty. We did have an historic surplus, which was required by the government over the years, and we managed to keep our in-year deficit in line with that historic surplus. But that didn't matter to the actual non-achievement of the target, unfortunately. Now, we had significant financial pressures, and I mentioned this at the time last year, particularly on hospital services and also within the drugs budget as well, on prescribing. And that was seen both on the Southport Hospital contract, as well as the Wigan contract and Lancashire Teaching Hospitals. So significant pressures within the hospital system that we saw a number of our partners experience as well, particularly in Sefton. And unfortunately, we weren't able to balance the books. It was the first time in the CCG's history that we weren't able to balance the books. So it was a disappointment, but it was very, very difficult to stay within the budget during last year. On a positive note, we did manage to achieve our payment duty that we paid all of our suppliers within 30 days. And we also managed to manage our cash balance appropriately. We also got a very clean bill of health from our internal auditors, who were happy with our financial arrangements for internal control and value for money. In terms of how we've spent the money, this is a similar shape to how we spent it in the past. And you can see with the big blue semicircle there, a lot of that money is going towards the hospital sector. Just over 95 million, and a big chunk of that goes to Southport Hospital, and that's where we spend a lot of our money, £50 million. We also spend money at most of the Merseyside hospitals, so Aintree Hospital, the Royal Liverpool. We spend money at Ramsey Healthcare and also into Manchester in Wigan, as well as across into Lancashire at Lancashire Teaching Hospital. So a real range of hospitals where our patients go. And that is certainly something that gives better access to people when they choose services, but can present some challenges when we're working collaboratively across a very vast area. In terms of the other areas, these are really important, because if we get the other areas right, particularly around community, where we spend 17 million, a big part of that is our community services with Virgin Care, as well as primary care, which is the GPs. You can see at the bottom there, 14 million, as well as the drug spend. If we start to get these areas right in terms of how we're working together with our partners, then hopefully we can prevent more people going into hospital at the end of their journey. So I think a lot of the strategy is about prevention and trying to maximise the budget in the best possible way, working with partners. And I think that's a big theme as well going forward. It's how we work really effectively with partners on some of these really difficult issues, not just in health, but the wider determinants of ill health. It's been a really, really challenging year, as everyone knows in the country. This has been no different to the CCG. We knew back in March that there was a virus that was affecting the world. We weren't quite sure what it was going to mean. We do now. We know it's a massive thing that's affected everybody's lives. we had to adapt as a CCG. And one of the first things we did back in February, March was we put an emergency response team within the local CCG to respond. And it's fair to say now we're in a very much a command and control type environment where the team within the CCG are operating at different levels. We're operating at a West Lancashire level, we're operating at a Lancashire and South Cumbria level, and we're also operating at a North West level. And not least the fact that governments as well give directives around COVID. So it's a very, very complicated environment. And I'd like to really thank the team for the way they've responded to it, particularly the partnership working with our partners in the West Lancs community. It's been a real sterling effort, and I'll come on to that in a minute. Okay, so collaboratively, as the West Lancashire Partnership, we've worked together to support the West Lancashire population. I think you'll be hearing a lot more about the West Lancashire Partnership going forward. This is where we see most of our work and strategy work around health and well-being being focused. And what the West Lancashire Partnership is a partnership of key providers, key organisations in West Lancashire who are there for the population of West Lancashire. Now, as of Thursday, as you all know, we're going to move into a 4-week national lockdown till at least the 2nd of December, and we're not sure if it's going to go beyond then. And this follows the fact that we've been placed in Tier 3, the highest restrictions. So really challenging times. What this meant for the team is we've had to really adapt to the virus. We've really had to make sure that services have been safe for patients. And there's a big challenge, of course, as most of you all know, about maintaining original services as well as dealing with the COVID patients. So we've had to, and very early on, I remember in April and May, we were doing lots of work within primary care and community care to reshape the walk-in centre, the urgent treatment centre, to make sure that it was able to deal with the fact that we now had to separate patients if they had COVID, to make sure that people were able to access it in a safe manner. And that was no mean feat. It involved a lot of logistical planning. We mobilised our primary community teams to offer remote phone and video consultations using technology. And I think some of that now, that technology will stay forever. Even though these are very, very difficult times, it's meant that we've been able to put in arrangements that can carry on now going forward. There's been lots of work with the care homes. We know from the news that the pandemic really affected the care homes to begin with in the crisis. It still does, but we've got a much better chance now of working together effectively with the care homes to make sure that we protect older people. So there's a big training programme in collaboration with the care homes to make sure they understood and could benefit from some of the support that was being given around COVID-19, infection prevention and control. And that is still in place now, and we still make sure that we supplement that as we go along. We've also been working with hospital colleagues around making sure that appointments can be done remotely as well, using systems like Attend Anywhere. So a real change in the way we do health. Now, obviously, it's still very, very challenging going forward. We need to make sure that we've got this very, very tricky balancing act of making sure that services can carry on while we still deal with the COVID pandemic. And as you know, that's been really difficult trying to get patients back into hospitals because people are naturally very scared and nervous. But the teams have done really well to try and give that sense of, or to make sure patients are able to get back to their normal services where appropriate. I think this was a really, really big effort at the start of the pandemic and continues. There was some really good work between people in the CCG team, as well as people in community services across primary care, and certainly with our West Lancs Borough Council colleagues, to make sure that we were identifying the right people who needed support. And I know there was a lot of contacts made with shielded and vulnerable patients. We've supported more than 5,000, which is a big chunk of our 113,000 population, contacted them directly, had people understand their needs. We've offered social prescribing support. I think we've had an amazing response from volunteers, both existing volunteers and people that have come forward. And there's been a really good coordination effort to make sure that people have been seen, people have got access to information, and where there've been some really intractable problems, that we've come together to try and solve them. And we've done that really well. That's not to say it's been easy, it's not to say that we've solved it, but we think we've made a really good effort across our healthcare and social care community to respond to that need. We've also been delivering medicines as well to people. So this has really been a change in how we've done things, and a lot of the things have been the CCG team really kind of rolling up their sleeves and starting to work differently, work with colleagues on the ground to deliver things. And that's been new for a lot of people from their previous jobs. So again, a big thank you to people in terms of how adaptable and flexible they've been. We've also had more than 3,500 residents access West Lancs Together. And this has been an online and a phone line that they've been able to access for information to help them in their daily needs during the pandemic. We've had people register for online shopping, and we've had help for them to do that. We've also been able to deliver food parcels to over 1,200 residents, so a real big effort in West Lancashire. I think one of the things that's really served us well is that we had a very, very good community in West Lancashire, particularly across the voluntary sector, and particularly as well within West Lancs Borough Council and some of the contacts there, as well as the social prescribers. So I think we had a really good basis to bring things together and make a response. And so that's been really good to see, and we've been building on that during the pandemic over the last 6 months. Okay, so there's just some more information and support available in West Lancs. Just want to make that clear what the other areas are. We're working on a West Lancashire Partnership draft plan. Like I said, the West Lancashire Partnership, you're probably going to hear more of that over the next few years than the actual CCG. It's probably where our focus needs to be going forward, and this is where the local focus will be across our partners in the health and social care community. So as you can imagine, a number of providers and organisations within West Lancashire have been meeting, talking about the health needs and the wellbeing needs within West Lancashire. And as you know, it's not, you can't just contain health. It goes beyond that into social care needs, lifestyle needs for our populations. So we've been trying to look at ways of doing that. For instance, from a finance point of view, in the area that I know, we've been looking at our budgets, and we've been looking at how we can use them more creatively across our partners, looking at how much money we spend and whether we can spend it better in a different way. So we've got a plan that we're working on, and it will be available shortly, and also physical copies will be available. We've also got a feedback tool, so we can again get some feedback around it, and we can refine it as we go along. But this will give you a good idea on how we plan to take things forward and maintain that local interest and that local flavour that we've always had in West Lancashire. One thing we did want to mention, we have a winter campaign every year. This year it's even more important, given that we've got COVID alongside it. And the two go hand in hand, really. We want to make sure everyone is as well as they can be during the winter period, because we're under no illusion it's going to be really, really difficult to contain the virus, as well as try and deal with some of the other health complaints that we've got during this time of year. So there will be a pledge, West Lancs Winter Ready, that we'd encourage you to make. And we're all trying to pull together, really, to give the right messages around improving our lives, particularly during the winter period. So I think that's going to be really important. I'll say something in a minute about mental health as well. Okay, so we also recognise, and I think this has been pointed out in the media several times, as well as the problems with COVID and the significant effect on physical health. the fact that we've had lockdowns, the fact that we've had a lot of people very anxious over this period, we've had people losing jobs. We recognise that mental health has really suffered because of this, and we're constantly on the lookout for initiatives and ways of helping people with mental health. And there has been a new talking therapy pilot launched in November, and I think it's really I'm really keen to make sure that we publicise this. It's part of the new IAP service, which is provided through Minds Matter. The new service provides residents facing common mental health problems such as anxiety, sleep deprivation and depression with a single point of contact they can refer to. You can see there on the slide how you can do that. There's a link to the Lancashire and South Cumbria Foundation Trust website around Minds Matter, or you can call that number 01695 684 177 if you need somebody to talk to, if you feel like you're really struggling from a mental health point of view. One of the other key areas that's certainly been in the news is around cancer as well, and we recognise that given the disruption that COVID's caused, there's an extra level of need now around ensuring that cancer patients are taken care of in the right way. And we've put a virtual support session in for people living with cancer, and the West Lancashire Cancer Support Centre, in collaboration with Southport Hospital, will host a series of virtual support sessions for cancer in November. The sessions are going to cover a range of relevant topics, and you can contact Caroline Flynn on 01695 402 164 or email to the email that's in the slide there for a full programme. You can contact anyone in the CCG if you want to know any more about this. And then back to staff as well. We recognise, as well as patients, staff are under pressure as well in the NHS, and we need to make sure that we keep all of the NHS staff, frontline staff, back office staff, everyone, volunteers, council staff. We're all going through it at the moment, both on a work and personal level. And there has been set up a Lancashire and South Cumbria Resilience Hub to support all healthcare workers, blue light workers, council staff, volunteers who've worked through the pandemic. So this is for people who need that extra level of support. And again, the details of the hub are on the screen. And finally, just some details around getting in touch with the CCG. I know that was kind of a whistle-stop tour of the accounts, the annual report, some of the changes from last year into this year, and particularly around COVID, which is dominating the agenda at the moment. But we're keen to hear from you if either you need to know any more about what we've said, or there are anything in some of the items that have been mentioned that you'd like some more information on, then you can do so on the number provided there, plus the email. We've also got a Twitter feed, and obviously we've got the website where most things, as I say, you can Google quite easily. Okay, so I think I'd just like to say thank you everybody for attending. I hope in future we're able to do this back in the village hall, in one of the village halls in West Lancashire on another time. Hopefully we will get through the pandemic soon. There is light at the end of the tunnel, and I'm really encouraging people to give us their feedback going forward as we shape services, and look forward to a more positive future as we go forward. Thank you.